Welcome to the 2022 benefits for Desjardins Bank. Your annual open enrollment period has just begun for the benefits effective January 1st through December 30th of 2022. This handy reference guide on page 2 allows you to put in information about your plan numbers, your ID numbers, maybe your username, your passwords that you might use on some of their websites. So you might want to keep this handy. When you have questions about your benefits, here's a useful guide with the main plans, telephone numbers, links that go to their websites. Plus, you also have information in order to call the Select Source call center at 877-936-3761, or you can contact me if you have questions about any plan information or if you have issues with claims. It's very important to stay in network whenever possible. You can always call 1-800-810-BLUE and reference the alpha prefix on your ID card, which are the letters IYR, to look for providers in the network. This is especially helpful when you're traveling. To look for providers when you are currently enrolled, make sure you log in to the myhealthtoolkitfl.com as a registered member. The system will recognize the plan you have and your location. If you are not a registered member, when you go to that website, you can click on Find a Provider and enter the same alpha prefix IYR. Enter your search criteria and make sure you change your location for the proper area if necessary. Your coverage travels with you, so make sure you go to the Blue Card Worldwide Service Center online or via phone to look for providers outside the United States. Instructions for how to register as a member at myhealthtoolkitflorida.com are found here. Once you are a registered member, you can also get the app for your mobile device, and you can look at your coverage, claims, order a new ID card, look at the provider directory, and use some cost estimator tools and more. The HSA plans 103, 104, 201, and 202, the deductible applies in every setting with the exception of preventive care. If you cover only yourself, you are subject to the individual deductible. If you cover one or more dependents, you are subject to the family deductible. In the PPO Plan 004, copays are applied to 8 of the following types of services: advanced imaging, ambulance transportation, ambulatory surgical centers, durable medical equipment, home health, hospice, hospital facility, and skilled nursing. With the EPO Plan 302, the deductible only applies to 5 services: ambulance transportation, durable medical equipment, home health, hospice, and skilled nursing. All of the other ones will be paid for with a copay. With the HSA plans, the deductible applies in every setting with the exception of preventive care. Let's review the plans side by side. We're going to focus only on the in-network benefits. Every plan has a calendar year deductible, co-insurance, and out-of-pocket maximum. That means this is your liability from January 1st through December 31st of each calendar year, and this year would be January 1st, 2022. So as you see in PPO 004, your calendar year deductible for an individual is $750. That means that you have to satisfy $750 worth of expenses that are subject to the deductible in order for the co-insurance, which is 20% of those charges, to be paid. If you cover anyone else on your plan, then the deductible is $2,250. On the PPO HSA 103 and 104 plans, the individual deductible this year is $1,500 and the family deductible is $3,000. The out-of-pocket maximum is $5,000. This means that everything that you have that is not preventive is going to go toward either the $1,500 deductible or the $3,000 family deductible before the coinsurance will come in at 20%. After those deductibles have been met, then any of the coinsurance charges will go up to $5,000 maximum. On the EPO 302 plan, the individual deductible is $500 and the family deductible is $1,000. And the out-of-pocket maximum is $3,500 for an individual or $7,000 for a family. The coinsurance is 10%. That means that after the deductible has been met, any other charges for any services that the deductible is applied to, and there are only 5 services within this plan, would have a liability of only 10% for you. And the EPO HSA 201 and 202 plans, the deductible is $1,500 for an individual or $3,000 for a family. The coinsurance is also 10%, and the out-of-pocket maximum is $3,000 for individual and $6,000 for family. Just keep in mind that the out-of-pocket maximum includes the deductible and the coinsurance plus all copays, and this is on all the plans. This is the most that you are expected to pay for in-network covered services through the calendar year, meaning that for family on the EPO HSA 202 plan, if you have $6,000 worth of billed medical expenses, anything after that should be covered at 100% by the insurance provider. Common across all the plans is that preventive care is covered at 100%. So make sure you're getting your annual checkups, going in for your periodic immunizations, screenings, anything else that's considered preventive, and you can get a list of preventive services based on age, gender, the frequency schedules on the myhealthtoolkitflorida.com website. Mental health, behavioral health, substance abuse are covered at 100% on PPO Plan 004 and EPO Plan 302. The deductible and coinsurance apply in every setting except preventive care on the HSA plans. Independent clinical labs, Quest Diagnostics is your preferred lab, so make sure you're going to a Quest drawing station or you are telling your doctor to send your lab work to Quest to be read. This is covered at 100% on plans 004 and 302, subject to the deductible and coinsurance on both HSA plans. Teledoc consultations are covered at 100% on plans 004 and 302. They are subject to a $55 consultation fee on the HSA plans. If you think about going to an urgent care center for possibly the flu, you have to consider how much time is involved in getting to urgent care, sitting there waiting for the doctor, being seen by the doctor, and then the visit will probably cost you around $130 if you're on the HSA plan. However, if you call Teledoc, they're available 24/7. The doctors can diagnose, treat, and prescribe. So within about 10 minutes, you can be talking to a doctor from your home or office for only a $55 consultation fee on the HSA plans, or free on the PPO and EPO plans. Regardless of which plan you're on, you should be using Teledoc for minor illnesses. Outside of Teledoc, if you visit a physician in their office, or even as a virtual office visit, on the copay plan 004 and 302, you have a primary care office visit copay, and then you have a specialist office visit copay. Primary care physicians are one of the 4 following categories: family practice, general practice, internal medicine, and pediatricians. Everyone else is a specialist and would be the higher copay. If you have an urgent care visit on those copay plans, you have an even higher or equal copay. For emergency room visits, it's a bit more expensive, but it's still pretty reasonable. Try to use emergency room visits for true medical emergencies. Use Teladoc, your doctor's office, or urgent care if it's not a true medical emergency. You want to avoid going to the hospital at all costs, even for diagnostic x-rays and imaging. Try to avail yourself of ambulatory surgical centers that are outside of a hospital facility in order to save money, because the hospitals will oftentimes have their own copay, and most things will be subject to deductibles in that sense. If you compare the PPO plan 004 to the EPO plan 302, the only plans that have copays, then you will see that the copays are less pretty much across the board, and many items that are subject to a deductible in 004 are just subject to a copay on EPO 302. So this makes this plan very attractive. It's costs less in premiums, and you wind up paying less in copays and in deductibles. The only difference is that it does not have an out-of-network benefit. So you do want to stay in network if you have this plan. The main differences between the HSA plans, the PPO 103 and 104, and the EPO 201 and 202, are that the coinsurance is 20% at the PPO, whereas it's only 10% at the EPO. So you may be spending less once you've met your deductible on the EPO HSA plan. Also, the EPO plan does not have an out-of-network benefit, whereas the PPO plan does. However, 99% of our employees remain in network, so this should not be difficult. Also, the EPO plan always covers ambulance transportation and ER visits outside of the network. So if you do want one of these high deductible HSA plans, you should really consider the 201, 202 EPO plans over the PPO HSA 103 and 104 plans. With your Blue Cross medical plans, you have a separate ID card for your prescription coverage. So make sure that you have both a medical ID card and a prescription ID card from Express Scripts. You will also want to register at Express Scripts online to manage your prescriptions, view your claims, use the cost estimator tools, and look for less expensive medicines, and also get the app on your mobile device. If you enroll in one of the high deductible HSA plans, 103, 104, 201, or 202, you can also enroll in a special health savings bank account, otherwise known as an HSA. You cannot have other health insurance such as Medicare Part A, which is free and automatic if you're over 65. So you would not be able to have an HSA account if you have Medicare Part A. If you have the ability to open and fund the savings account, you can let your HR person know and give them the account and routing numbers, and then you can contribute to your HSA through payroll deduction. The money will come out of your paycheck pre-tax, meaning pre-federal, and then the FICA taxes, which are Social Security and Medicare. This will save you about 30% in taxes total, and then you can start building your HSA account balance. There is no time limit in spending those funds, so if you are able to have the account for 10 years or so and fund it up to $15,000, then that's money saved that you can spend later on medical, dental, vision expenses, or certain other qualified medical expenses. You can spend these funds tax-free on your dependents even if you don't cover them on the medical plan. And eventually you can spend these funds tax-free on your Medicare Part B, Part D, Medicare Advantage premiums, COBRA premiums, and the like. If you are eligible to fund an HSA, the contribution limits for 2022 are $3,650, if you cover only yourself, and $7,300 if you cover one or more dependents. If you're age 55 and older, you can contribute up to $1,000 more each year because you're closer to age 65. And once you turn 65, you're typically enrolled in Medicare Part A, and your enrollment in Part A disqualifies you from funding the HSA anymore. Everything in the account is yours to keep. You can earn interest on it, save it, or you can spend it tax-free on qualified expenses. Contributing through payroll is the best way to contribute, but you can also take money from a personal checking or savings account and deposit it directly into the HSA. You can then take an above-the-line deduction on your income taxes, but you will miss that 7.65 FICA tax savings unless you run it through payroll. Although the bank does not offer an HSA, there are many HSAs available, and you are free to choose from any of the banks that do offer them. One useful place to go to find HSAs is hsa.gov. There is also hsabank.com, which is an easy to use bank that you can set up online. And afterwards, there's really no reason to go into the branch, so you can do everything electronically. We have changed dental providers this year, although the plan type and the structure is similar to what you're used to. This is a dental HMO. It's offered through MetLife. You must go in network, establish a primary care physician. There is no annual maximum, and everything is simply based on the fee schedule that is found in the annex at the end of this guide. There are some benefits that are no cost. You just need to make sure that you are going through your primary care physician for them, and that they are referring you to specialists that are in network as needed. If you need to change your primary care physician, you can do that by contacting member services. When you look over the annexed fee schedule, you can clearly see what things are going to cost you. We are also keeping the same vision plan through MetLife, which uses the VSP network. Eye exams are covered every 12 months for a $10 copay in network. There is a $15 copay for materials. Frames are covered every 24 months, and lenses are covered every 12 months. The lenses are covered under the copay unless you need add-ons like progressives or any options such as scratch resistance, anti-reflective, and UV coating. Then that costs extra, but it's discounted. Your frame allowance is $120, and you will get a discount for any balance over and above that. If you wear contact lens, they are covered every 12 months, and in lieu of glasses, you get the same $120 allowance you would have received on your frames, and you will get a discount on your contact lens fitting and evaluation, but pay no more than $60. There are additional discounts for a second pair of glasses, sunglasses, LASIK surgery. If you do go outside the network, you will have to pay them in full, then file a claim online, and then there will be an out-of-network reimbursement that you can see here on this page. That is no more than $45. You can find participating providers by going on the metlife.com/mybenefits website or calling the 1-800 number here. Always verify when you make an appointment or go to a provider that they take the MetLife VSP plan. There are no changes to the coverage or the rates of the group voluntary accident insurance offered through Allstate Benefits. They have 2 levels of coverage with different premiums for each level, as you can see on this page that's highlighted. This policy will give you benefits for on or off the job accidental injuries. If you seek treatment due to an accidental injury, whether you twist your ankle, break a bone, cut yourself, or burn yourself, or if it's even a more serious accident where you're in the hospital, or something minor where you go to urgent care or the emergency room, there are benefits. There are also benefits for accidental death, accidental dismemberment, ambulance transportation, and your initial hospital confinement and then daily hospital confinement. Benefits also include CT scans, MRIs, cuts, burns, dislocations, fractures, physical therapy. The list goes on and on. And as you see, there are different reimbursement benefits based on which level of coverage you have gone into, the plan option 1 or the plan option 2. Another great benefit is the outpatient physician's treatment, which is in each plan. If you cover only yourself, you can claim 2 of these claims every year. If you cover 1 or more dependents on the plans, you can claim 4 of these claims every year. An outpatient physical treatment means you saw a physician in their office or you saw a physician outside of the hospital. It could be your wellness exam, a skin check with a dermatologist, eye exam, a chiropractic visit, or even a teledoc virtual consultation. The claim is a reimbursement of $50 per claim on option 1 and $75 per claim on option 2. It's a simple claim form to complete and submit. Make sure if you have this accident policy that you are claiming that annual benefit. Your short-term disability benefit is provided by the bank. You'll receive 2/3 of your weekly income to a maximum of $1,000 per week if you're disabled and unable to work. If you are still unable to return to work after 3 months, then this becomes a long-term benefit and you will receive 60% of your monthly income for up to $5,000 until you are able to return to work or possibly your normal retirement age. There is a 2-year own occupation, which means that if after 2 years on long-term disability that you can do a job, just not the job you were doing before you were disabled, then the benefit may end. However, if you could not do any job, this is where you would be covered to a Social Security normal retirement age. The bank also provides most eligible employees with life and accidental death and dismemberment coverage insurance through Mutual of Omaha. For regular employees, not officers, the benefit is one time your annual salary to a maximum of $500,000. Plus, there is an additional $20,000 benefit. There are benefit reductions that kick in at age 65. This policy is convertible. You will have up to 31 days to contact the insurance company if you leave the bank and wish to retain this policy. This is something you might want to do if this is the only life insurance policy you have and you have a medical condition that makes you uninsurable. You might want to retain this as it might be the only life insurance you will get. Employees can choose to purchase additional life insurance on a voluntary basis. If you take this benefit for yourself, you can also cover your spouse or domestic partner and your children. Employees can get between $25,000 and $500,000, not to exceed 7 times your salary. For your spouse, you can elect from $25,000 to $50,000, not to exceed 100% of your benefit. For children, you can get between $2,000 and $10,000, not to exceed 100% of your benefit. Benefit reductions begin at age 65. If you are applying for this coverage for the first time and you are not a new hire, you must complete evidence of insurability, and your application is subject to approval. If you currently have this product and you wish to retain the same amount, no further paperwork is necessary. But if you want to increase your benefit, you also need to complete the evidence of insurability. Rates are based on age, and as you get older and enter into a new rate bracket, your rate will increase on January 1st when the policy renews. Your spouse's rate is based on your age, and if you leave the company, this is also convertible. So you can contact the insurance carrier and inquire about your individual purchase rates if you wish to retain this policy. This rate schedule requires you to do some math, but the enrollment system should have the rates preloaded, and you should easily be able to see what your per pay cost will be. The Employee Assistance Program is through the National Center for Performance Health. They can help you with stress, whether you're anxious or depressed, if it's you or a family member dealing with any issues, family, work, financial, medical, legal, substance use and abuse. Access is only a phone call away, and you can call 24/7. This is a free service and it is 100% confidential. You can get referred to a local provider for up to 3 face-to-face visits or 12 telephone visits. Take advantage of this program that's free to all employees and their family members. Through Access Perks, you can make purchases at discounted rates, be it for theme park tickets, dining in restaurants, flights, hotels, vacations, or discounts on products. There are a lot of different deals that you can take advantage of. This is a service that is completely paid for by the bank. So make sure you go onto the website listed in step 1 or call the phone number down at the bottom of the page to get started. MetLife Legal Services gives you access to the Hyatt legal plans. You can go online to register or call to find an attorney who can help you review contracts, answer questions, represent you in court, prepare a will or medical power of attorney, among many other things. There are a number of different reasons that you might want this program. Attorneys can be very expensive, so if you would like to speak to an attorney at no additional cost, give some consideration to signing up for the MetLife Hyatt legal plan. It costs $200 a year, which makes it $9.23 per pay. That's a lot less than an hourly charge of about $300 for a regular attorney consultation. LifeLock with Norton by Symantec is also available. You can sign up for this benefit online. The rates depend on which type of product you choose and if you want coverage for yourself or for your family. This program will help you if your identity is stolen, if you want someone to monitor your identity, and if there are any issues, if you lose your wallet and need help getting everything canceled and need to replace IDs and cards, among other things. LifeLock can be a big help to you. Outside of open enrollment, you can only make a change to your benefits if you experience a qualifying event. A sample of the most common ones are highlighted in the green box. If you think you might be experiencing a qualifying event, see your HR advisor as soon as possible because you are limited to 30 days to request a change after the event occurs. To enroll online, make sure you go to the Benefit Solver website. The company key is FBHC. That stands for Florida Bankers Health Consortium in lowercase letters, referenced at the top and bottom of this page. You can also find the link in the SharePoint under HR Zone and the tile that says Open Enrollment. Make sure you get the app My Choice for your mobile device so you can access all of your benefit information in one place. You can also store copies of your insurance ID here for easy reference. If you have any questions, refer to the contacts page at the beginning of this booklet. As your HR advisor, I am also here to help you during this enrollment period and with any other questions and issues you may have throughout the year. Thank you and happy open enrollment.